Good morning, CHD. Welcome to Pediatric Perspectives, where we are looking at children's health challenges with a different perspective, one that includes critical thinking, one that's not afraid to give you the honest truth. And today, we are covering childbirth. And I have a special guest, OBGYN Scott Hankinson, and we're going to dive into how to safely get a baby into this world. And there's nobody better than Scott. I am so thankful that we have you on the show today.
Wow. Thanks, Paul. Glad to be here.
I am curious. Right before the show, I found out you're almost the same age as I am. I was like, man, you just don't look that old, but you have a lot of experience. How did you go straight into medicine right out of college?
Basically, yeah, it took a couple extra years of traveling, but basically it was a 6-year plan in college and then straight to med school.
Gotcha. I did the 6-year plan getting a master's before I got in. So that was my 6-year plan. You were obviously smart enough. You could go play for 2 years. That's the way to do it.
Actually, I started a master's in public health program.
Okay.
And then I was kind of disillusioned after the first semester. So that's when I decided to take my new wife, and we spent basically 8 weeks touring through Europe.
Wow. What an adventure. So other than that, you've been doing OBGYN work your whole career.
Trained from 90 to 94. Actually started independent private practice 6 months before graduation. So I was actually seeing patients evenings and Saturdays because there was another physician who was going to go do a fellowship. So literally July 1st, the first day I wasn't attending, I had like 3 deliveries and a couple operations. So wow. it was really hitting the road running.
Wow. So then just to kind of give our audience a sense of what it's been like for you, talk about the changes you've seen in your career, if there have been any, in terms of the process of bringing babies into the world.
Well, that particular process hasn't changed much. Still the basic concepts, but I would say definitely the environment around the patient has changed a lot. I mean, I'm a little unique in that I was in private practice for about 20 years. Then I started doing this thing called locum tenens, which meant I traveled around. So since 2015 until recently, I was doing that type of work, which meant I was in places for 6 months to a year and a half, all around the country. So my perspective is developed or created by this concept that I've been in the smallest of the small hospitals and the biggest of the big. I mean, literally, the hospital I am in now is my 39th hospital in my career. And wow. I think that encompasses probably about 10 states, all the way from, I'm currently in Florida, we were in Hawaii for a year and a half, all the way up to Maine. I started COVID outside of Seattle. So, that makes it a unique perspective for sure.
I really want to tap into that perspective because my mom was a nurse midwife. So I think you remember I was a missionary kid, right. And we were teasing you wanted to be a missionary kid, but I did have an incredible life, and she delivered babies as an RN, not trained for delivering babies, but the demand was so high for help, and infant mortality where we were in Africa was very high. So she was bringing a benefit. Right. And so I grew up knowing that there's home births is a real legitimate option. And then as a pediatrician, it's all hospital-based medicine. And I imagine most of your experience was hospital-based also, right?
Right. I mean, I have gone overseas a few times, but as far as in the US, it's always been hospital-based, yeah.
So what's your thoughts about, the difference between a major teaching hospital versus a small community hospital, since you've been around? Are certain environments having better outcomes, shall we say? And what are the metrics for a better outcome?
Yeah, well, the metrics are probably are obvious in that a healthy baby and a healthy mom. I mean, mm-hmm. Outcomes within that, people like to look at things like C-section rates or other minor procedures that they focus on. But ultimately, obviously the bottom line is a healthy baby and a healthy mom. And I haven't seen that much difference in all the different places, to be honest with you.
Mm-hmm.
I just think, people ask me all the time about this hospital or that hospital. And honestly, I think it really comes down to the people that are there at the time and the perspectives of the patients, when they come in as far as their expectations. My emphasis has always been to really put myself in the place of patients. So obviously, I'm not going to have a baby, but my wives, my children, friends, etc. So, I really just try to see it through their perspectives. And as far as things like losing control when they get in the hospital, that's a common theme, especially now since COVID, that comes up quite often. And to just reassure them that their autonomy doesn't change when they come in. And at least for me, my goal is whenever I'm going to do something, and again, in obstetrics, it's usually doing a C section when it's not scheduled, that they are clearly part of they meaning the patient and the father of the baby are clearly part of the decision making process. And I don't want anybody guessing after the fact like why XYZ happened.
So walk us through that. I'm coming into the hospital to have my baby. I'm in contractions, and you, as my doctor, sent me in. You're going to meet me at the hospital, I presume, at some point.
Mm-hmm.
I do get the sense that we lose a lot of control when we walk into the hospital. It's like
Right.
we become part of protocols.
Right.
And I know in pediatrics, there's protocols that I had to fight because they were, for example, and I know this is in some circles is controversial, but hepatitis B and vitamin K were automatic. They were standing orders, and they would happen the first hour of life before
sometimes within the first minutes.
right
Literally.
before I'm there. Right. I haven't even gotten the call that baby's born, and it's happened.
Right.
Are there protocols in the OB delivery process that sort of sometimes take over?
Not so much along those lines, although, again, that is one of the conversations I have with all my pregnant patients. So they know, especially what's going to be kind of the default mode for the baby, unless they're, specifically, I'm really a promoter of a birth plan.
Mm-hmm.
And, I never used to be that encouraging of that because, again, from my perspective, it didn't change anything. I mean, I was going to honor the patient's wishes, whether she did or didn't want an epidural or, wanted to wait longer if it looked like we were heading for a section, as long as the baby was doing fine. So again, I always have really focused on patient autonomy, but especially since COVID, as I have become more aware of the issues around the baby, I just really encourage them to start educating themselves about what the default things are going to be for the baby, like the antibiotic ointment, the vitamin K, the Hep B. And so they have already been aware of it and made a decision because, a lot of times, especially when it comes to hepatitis B, the consent is in this stack of papers that the husband signs when they're coming in. And, at that point, especially if it's first baby, she's in pain, she's maybe anxious, he's clearly anxious, and he's just going to typically sign that stack of papers without looking at them. So I always want to make sure that they know what to think about and talk about and make a decision about ahead of time before that moment comes.
Yeah. Are your peers doing the same? Do you think? Are they preparing them for those decisions?
Probably not.
Yeah. That's what makes you special. So right now, are you still in Florida?
I am.
Where in Florida?
Southwest, just north of Fort Myers, at a smaller town called Port Charlotte.
Okay, well, if you can have your baby there, folks, you look up Scott Hankinson. I'm telling you, he's gonna help you be informed. For those who can't see you, are you able to be a little bit specific? I understand that ACOG and the AAP, the Academy of Pediatrics, they have their guidelines, right? And sometimes, however, in individualized medicine, when we're having conversations with parents, we don't want to go against our academies as far as that goes, just because it's risky for our careers. But I think we're obligated ethically and morally to at least share what we would do. Maybe like if a new couple asked you, I don't know if you're able to share what you would do if you were in their shoes.
Well, I think the way that I would answer that is, again, I really resist any kind of idea that I'm telling them what to do, and I'm sure you would agree with that as well. I see my job more of educating and especially pointing them, and especially I'm not a pediatrician, so it's important, especially these days, to kind of stay in your lane a little bit. But I do emphasize again during the prenatal visits. I mean, I refer every one of my patients to you, for instance. And by the way, I'll just plug Facts. I can't wait till it comes out,
Yeah.
because I probably will buy a few boxes and just hand them out to all my patients. So, that's my approach. And right now I have a handout that I give to every patient, and it covers a lot of things. It sends them to my YouTube channel, where I've posted some unsophisticated videos of what I think is important, because I am so enthusiastic about these issues that I literally will spend all day talking to a patient, and then I'll go to the next room and spend another day talking to that patient. And that doesn't work well if I have more than 2 patients scheduled, right?
Right.
So what I've done is I've created this YouTube channel, and I have the important things on there about nutrition, about epigenetics. I'm sure we'll get into it, but my real focus in all of health is the microbiome. And, my knowledge of the microbiome has just exploded over the past, basically 4 years, kind of simultaneously with the beginning of COVID. And that's where everything in the future of medicine's at. It's the microbiome, in my opinion, and it's epigenetics.
Yeah.
And I intellectually had heard of those things before, but now, I mean, it's just amazing the difference that you can make in a pregnancy and your children and even your grandchildren, based upon what you do or don't put in your body.
Wow. We're going to have you back for an episode that really focuses on pre-pregnancy and pregnancy and what to do to optimize your microbiome and
Right.
really optimize health outcomes. So folks, don't miss episode 2, because we're going to get into those topics. But as far as the delivery itself, I get the sense it's a good idea to avoid C-section if you can.
Right.
So what do you advise young couples, or, obviously sometimes we have older couples now having babies, but what's your advice? How do they reduce that risk of ending up in a C-section?
I'm not sure there is a way to reduce that risk. One of the variables that is debated whether it does is whether to be induced or not. I have found that a lot of times when patients are induced, and sometimes, I mean, there are medical inductions and then there are elective inductions. So if there's an indication for an induction for the health of the baby, usually, then that's different. Then you have to do it. I mean, or at least you recommend to do it. But a lot of inductions are elective. And I have found through the years, and especially over the last year that I've been here, that a lot of times elective induction babies end up coming in facing the wrong direction, which really increases their risk for the need of a C-section. So, most babies come facing down. So I'm not talking about breech, I'm talking about head first. But most babies come facing down. And, the lay term is sunny side up. So when the baby comes in facing up, we call it a OP, or a occiput posterior position. And that greatly increases. In fact, I would say the 8 or 9 months that I've been here, every C-section I've done that was unplanned and unexpected was because of an OP baby. So sometimes I think inductions might increase the risk for that, but not always. I mean, it happens in spontaneous labor. And it's also true that people can deliver an OP baby. That happens too. Happened the other day for me, actually. But it's a lot harder. And sometimes you have to use things like vacuums, or some of the other guys would use forceps. But definitely that's one issue. But then the other issue is probably unavoidable. I mean, depending on the shape of the woman's pelvis, depending on the size of the baby, if this is the pelvis and this is the head, it doesn't matter how long you wait, it's not coming out plan A. And of course, the obvious is that we live in a world where plan B is safe and effective, as opposed to some of my experiences in Africa. And I'm sure your experiences in Africa as well.
Yeah.
Yeah. I'll just throw in one thing though that I'm thinking of as I'm mentioning the C-section thing. And this is really, I don't think any OBGYN in the country has ever heard this. So you can report this as breaking news.
Okay.
But I'm about to interview a guy named Michael Hollick, who is a senior physician out of Boston University. And he's been doing vitamin D research since the 70s. And I'm ashamed to say that I've really only been aware of his stuff again for about the last 4 years. But he actually has a paper showing decreased C-section rate based on vitamin D level, which
Wow.
is not really intuitive, is it?
No. Do you have a sense of what that mechanism might be?
Well, his sense of it, and again, I haven't interviewed him yet because I'm definitely going to talk about this, is the pushing ability of the mom. That
Oh,
with
interesting.
adequate vitamin D, you have better muscle strength and able to push stronger.
Interesting.
I don't know.
Well, I am a huge, huge proponent for vitamin D, and at levels that will bring your uh, body tissue levels to a range of 50 to 80. Uh,
Absolutely. Yep.
and most people are living in the teens, or sometimes I've had patients who are in single digits.
I see it every day. I check all my patients here, and I can't tell you how many single digit, high teens, low 20 people I've
Yeah.
seen in the past 6 months.
Yeah. I was checking
And this is
everybody
in
as well.
Florida, right? This is in Florida too.
Okay. So I have a thought for how much vitamin D a pregnant mom should take, but what's your recommendation? Because if you're testing, you're also making some recommendations,
Right.
and you're retesting later, and you're seeing that it's actually getting them to where you want them to be, I'm guessing.
Yes, with the caveat that it takes a very long time to get levels up, as I'm
Yeah.
sure you know. So the half-life is very long. So, you're really talking probably a couple of months at the minimum
Yep.
to even get them up in that. My goal is 50. So my goal is to have every patient over 50. And I haven't seen one yet at term. Actually, I just saw one for the first time get in the 40s. But usually I'll bring them from the teens up into the 30s or something. And
And
that's
what
where that preconception appointment is so important. And that, again, I've kind of become a vitamin D nerd because I'm going to interview this guy and I want to sound good. And I tell you, the more you look into vitamin D, the more benefits there are. I mean,
Yep.
it is remarkable. So,
And what doses are you comfortable with in
but
pregnancy?
yeah, so I kind of, as an official recommendation to patients, 4 to 5,000 a day is kind of. I mean, honestly, if it were someone in my family, I'd probably go higher because we talk so much about vitamin D toxicity, and again, not referencing myself, but this guy like Dr. Hollick, he'll just say that is. I mean, the one case that this guy had vitamin D toxicity, the sample was sent to his laboratory and he was taking over 1 million units a day.
I have a story to share on that.
Not
So
intentionally. It was because
yeah.
his supplement was poorly manufactured.
So I carried a supplement in my office when I was in practice. I'm retired now. That was 1,000 IU's per drop. So not per dropper, but per drop. And the instruction for newborns was 1 drop a day, 1,000 IU's a day. Well, this family misunderstood and they were giving a dropper full. So I checked, there were 17 drops in a dropper full. So this newborn was getting 17,000 IU's a day for 3 or 4 months before we figured out that's what they were doing.
Yeah.
And the level they had was a little over 100, absolutely no symptoms.
Right.
So
most people in my family are over 100. I come from a family that has, remember the HLA B27? Do you remember that way back?
Yeah, for autoimmune and stuff.
All 6 of us have that. So we all technically have this ankylosing spondylitis, and we were all on Humira or Enbrel before COVID.
Oh, wow.
Once we got our vitamin Ds up, everybody went off those biologics. Because as I found out, again, it hits so many different areas. It's actually a tumor necrosis factor inhibitor, just like Humira is. Wow. So again, another testimony.
Yeah, vitamin D is absolutely essential. And when we get into the next episode with you, we'll cover all the diet, nutrition, biome, and those sorts of things. Yep. So to wrap up the delivery experience and how to really maximize the health for your newborn, I do want to touch a little bit on Hep B. Just it's kind of more in my wheelhouse in the sense of I'm a pediatrician,
Right.
but I don't get to see these babies until sometimes they've already gotten the Hep B shot. But what I recall, and this is what I want to double check with you, OBGYNs have always done a masterful job of during pregnancy screening moms, the mom who's about to deliver a baby for their hepatitis B status. And
Right.
is that still true?
Everybody gets screened at least once. And now, because like I said, I've been traveling around until recently, every practice kind of did things a little bit differently. But in the last 5 years, I'd say at least 90% of the practices are screening twice. So they're screening at the initial visit, and then they're rescreening at their 28-week labs.
And since you've had an experience in multiple states and hundreds of hospitals, or at least over 100,
Feels
what percentage?
Actually, but it feels like hundreds.
Okay, what percentage of the moms that you've cared for were high risk for pregnancy for Hep B?
Oh, well, I was about to say I can't remember one.
Okay,
that's how rare.
And how many of you screened? Would you guess?
Oh, thousands.
Thousands. Okay, that's what I've experienced as well. I had in my career one mom who was Hep B positive, and in that situation, I think you would probably agree, but I want to have your input on it. At that point, it makes total sense to give that baby the hepatitis B vaccine, the HBIG. I mean, that's probably standard protocol in the hospitals, right?
Well, yes, but you did bring up a good issue, is that, and I don't know the data on this. So, I mean, to answer your question, yes, I would probably recommend it for that particular baby. Or, again, I don't recommend for babies, but I would, in the counseling of the mom, I mean, it's what I do today. In the counseling of the mom, I tell them hepatitis B for the baby used to be indicated for moms who had hepatitis B during pregnancy. And, again, almost always, I mean, again, I think I can remember 3 or 4 cases in my entire career where moms had hepatitis B. Now, certainly if you're in an inner city clinic and there's a lot of IV drug use, then those numbers are going to be different. But in the general suburban populations that I've always been in practice, very, very rare. But yeah, I would say in that situation, it probably makes sense. Although I would defer to the pediatrician and say, if you give HBIG to the baby, then is one better than the other? Do they work synergistically? That would be the question that I would ask the pediatrician.
Yeah. Yeah. And for the other 99.9% of moms who do not have any active Hep B situation, and we know they don't because you guys do such a masterful job of screening and testing.
If a patient comes into the hospital now in labor, I think they have a rapid test. They'll even test the mom right then and there, so you'll have maybe a day or two sometimes before the baby comes out. So it's extremely rare to have a delivery where you do not know the hepatitis status of the mom.
Yeah. So there you go, folks. This would be a very, very important issue to have in your birthing plan is, if you are very, very low risk, which is you don't have hepatitis B, do you put in your birthing plan that you don't want the hepatitis B shot for your newborn? That shot has 250 micrograms of aluminum, a way toxic dose for that little sized body. You're not supposed to exceed 3 to 5 micrograms per kilo, and baby only weighs 4 or 5 kilos at most. So 15 micrograms at most, you're injecting 250. Okay, that's my plug. I want you to have the last word. What's your parting special message to expecting couples as they anticipate getting into a hospital, most likely, and how should they best prepare to have the optimal outcome for their delivery?
Well, again, depending on where they are on this discussion, nutrition. I mean, my byline is organic green beans and vitamin D. So that's pretty much summarizes everything. That's why I could never write a book on it, because the whole book would be that one, line. But as far as labor and delivery, I do encourage a birth plan. I do encourage do your homework now, because again, especially first deliveries, you're going to be overwhelmed. That would be normal. And you're going to be super excited. And You're going to see things. You're going to see literally a human come out of your wife, which, I've done thousands of them, and I still have fun every time. I still think, isn't this incredible? Here's this little person literally coming out of you. So the point is, you're going to be told that the hospital does certain things based on national recommendations, and you're going to be asked if you want those things. And so now is the time when, during the pregnancy, or even, if you're not pregnant yet, now's the time to learn about it, so that you can make an educated decision and, truly have informed consent. Because, the sad part is, I would argue that you don't really get informed consent these days on agency recommendations, because, and in full disclosure, it's only been the last 4 years that I think I have given good informed consent. So, there's some sadness in me that for the previous years, I was just parroting what I had been told with my education and with my residency and with national organizations. So well-meaning clinicians, whether it's a OB or a nurse midwife, they think they are and the nurses and the hospital and the pediatricians, they think they're recommending the best thing for you and your baby. And they think that because they trust the organizations that are telling them what to say. And again, I did the same thing. But now I know that it's important for the parents to do their own homework and come to their own conclusions before that time arrives. That would be my parting comment.
I would add to that parents, go check out Dr. Hankinson's YouTube, because I think you really spill the beans very nicely there as far as being.
I get the pun.
Yeah, you the green beans.
No, it's greens and beans.
Okay, good. I thought you said green beans.
But the key there is organic.
Organic. And what is
the whole idea is help Biff.
Okay.
We'll talk about that more later, I guess.
We're going to get you right back for another episode for sure. What's your YouTube channel? How do people find you? @ Whole Foods Health. Okay. YouTube @ Whole Foods Health.
Yep.
Fantastic. Scott, Dr. Hankinson, thank you so much.
Oh, thank you. And, I didn't get a chance to say it, but you are, what's funny is that who would have thought that a physician would have thought of another physician as like a rock star, and actually had what's that phrase when you get starstruck, right? When you get starstruck. Well, in case people are watching this for whatever reason and they don't know, there are about, I think it's honest to say, maybe 10 super generals that have come to the surface over the past 4 years. And maybe it's only 5, but Paul, you are definitely one of those. And I know you're a reluctant general, but
I'm not reluctant anymore.
Yeah. Well, again, I mean, whether it's God's design or whatever you want to call it, but you took the events that happened to you, and you have even a bigger ability to change people's health now than I think that even when you were seeing patients one-on-one.
Oh, absolutely.
So it's a great honor to be here.
Well, thank you. And it's a privilege to have you on the show, and I'm going to get you right back on this show for sure, folks. Thanks for watching. You can check out my other show, With the Wind, at doctorsandscience.com. And you can also take a coaching session with myself if you wish at kidsfirstforever.com. Those links are in the show notes. Thank you for your time today, and I look forward to seeing you next week.
This and all CHD TV programming is made possible by generous support from viewers like you. Please consider making a contribution today to keep our programming going strong. Thank you.